amazingly. So loads of people want to know about AI and stuff and things
Was
and
that the
how
first
that's working.
5 event?
It was the first
Happened
5
locally.
event, yeah.
Yeah,
The feedback
Dr.
was
Waldron.
amazing.
Dr. Waldron was
Yeah,
talking to me about it. He said you were there and you did a good talk.
no, they did a great job actually, and it went really well, I think. So hopefully, really well valued and stuff and things. But AI was just like bang, 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 bang. So maybe we need to talk about AI at one point on the channel. I think we need to start doing that.
Yeah, because you've become quite an expert, and you're doing. I've seen you do a few talks about it, so that'd be really good. I mean, to be honest, we could have a chat together, and I could interview you a little bit about it, and I'd like to learn a little bit from you on it. So that'd be good, and I'm sure people could join in and ask some questions. So maybe we can do that.
Yeah.
Cool.
So we've got coming in and slow and steady. So welcome everybody as you join us. We're going to get started in a second. As ever, this is our lovely soft start as we just chat away and welcome you to this session and stuff. And we've got something really interesting and unique planned for you today as we talk about the health manifestos, don't we, Andy?
We do, yeah. So election fever is gripping the nation. I don't know if that's true. I could have the election tomorrow and be done with it, I think. I'm kind of sick of it, but looking forward to talking about the health manifesto, because a change of government could be really, really big, couldn't it? So so really interested to also see what people think out there as well. So hoping this is going to be really interactive and fun, dare I say it.
Can we make the election fun? That's an interesting thing, isn't it, Andy? Well, we were going to try, that's for sure. Right, so shall we get started? I think that's probably a good place to go. Yeah, okay, cool. It's only a couple of weeks to go till we've got a national election, and as ever, all the parties are telling us about what they've got planned for health and NHS and various other parts in terms of how this will affect what we do in general practice and wider. So in this episode, myself and Andy are going to review the various health manifestos that exist from the main 5 parties in England, and also compare how they look, what they mean, help you decide who you need to vote for as we tech enhance your primary care and learning. Hello, EGP learners, and welcome to this episode where myself and Andy are going to review the health manifestos from the various different parties in the run-up to the UK election in 2 weeks' time. What are you thinking there, Andy?
Yeah, I'm excited. As I was saying in the prelude, give me the election tomorrow, and I'll probably take that, I think. But 2 weeks to go, and I'm looking forward to looking at these the health manifestos. Actually, I suppose it's important to say that we don't really want to influence how people vote. No. Really, we just want to raise awareness of the manifestos, that they're out there, encourage people to have a look at them. And I think we'll be looking at some of the individual suggestions and policies within the manifestos and kind of giving our reaction and our impression personally. But I think the main sort of message tonight is, please vote, and we don't mind who you vote for, but please do go and exercise your vote and be informed and have a look at the manifestos and the documents that we'll be going through today. I think that's probably where we're pitching this, Gandhi, would you say?
Definitely agree with that. So yeah, we're not here to influence your decisions. We're here to show you the manifestos themselves and maybe talk a little bit around it. You may get our personal opinions, but this is about giving you the information to help give you an informed choice so that you can vote. And please do vote on the 4th of July. That's the one thing we will ask from you. So please vote. But actually, we're not the only ones that have looked at the various different policies out there, Andy. There's various people that have done, and we are going to give a massive shout out to 2 organisations in particular. That's the King's Fund and the Health Foundation, who've both done some amazing work in this. We're going to show you their stuff in a second. But just before we do that, I think one thing I wanted to comment on particularly is actually reading the policies themselves. Now, why are we talking about this? So Andy's flicking through things, and we're going to show you the various different policies and the manifestos from the 5 main parties. So to be clear, we haven't really covered the SNP, and we probably could have done. It's just we kind of A, ran out of time, and B, for the majority of our viewers, actually, it's more focused on England and stuff in terms of the election and things anyway. But Andy's showing us the Tory party kind of website for their manifesto. What did you think of this, Andy? I'm going to reserve my judgment so you go first.
Yeah, well, so I guess at the moment we're talking about kind of how they're presented, how accessible they are, really, and there's some differences. So the Tory party have a website that kind of steer you towards an embedded PDF that you can download. So they've very much got a PDF document as their manifesto, which I think is quite traditional. It can be printed, can be circulated. You go into the document and you're not able to click on the contents page to go to the bits. Which I think you need like the expensive version of the PDF collator to do that. So it's interesting that you can't do that, and it just reads like a paper document, which is interesting. What I would say about this is it is easy to pick out the individual pleasures. They do take them out as bullet points, which is good. And when we contrast this with the Labour document, you'll see why I'm emphasising that. So in terms of the format, I mean, I think it's traditional, but I think it's fairly accessible and was quite easy to engage with. I mean, what did you think about this, Gandhi?
Yeah, I mean, I'd agree with you. I did find it a little bit interesting that the only way to read the manifesto, like you say, was as this embeddable PDF. And when you try and open it up, it just takes over the whole screen if you do it on the website and stuff. And it's not as easy to navigate because it doesn't have clickable aspects to it and things. It is well laid out. It is quite big. It's 80 pages long. So it's not short. And so the positive thing is there's lots of information. How useful that information is a separate part, but we are focusing on the health aspect, which is page 39, I believe, out of 480. So a fair amount of stuff there. Massive contrast to the Labour version, isn't it, Andy?
Yeah, so the Labour version. So I think this is really, really interesting. They probably do have a PDF version out there, but the website doesn't immediately take you there. And so there's a few things I found interesting about this. So it's very much a website that you go in and you click around. And there are we're in the health bit here, but if we go to the sort of the main area, there's sort of embedded little sort of bits of video that run in the background, and there are videos to watch which explain policies and give kind of voters experiences. There's lots of like embedded images, and I wonder, maybe not this election, but in future elections, I wonder if different people could be served up different images, based on their demographics and their interests. I mean, that might be a little bit sneaky, but those are the sorts of things that you can do with these kind of website-based things, and they probably get some kind of information in terms of how people are interacting with the manifesto, in terms of what they're clicking, that they might be able to use in some way. So that's interesting. The other thing, Andy, that irritated me about the Labour manifesto is as we scroll through, you'll see it's all prose. There's a little video, Keir Starmer. And it's actually really difficult to pick out like the individual pleasures and promises. You really have to. Really glad that the King's Fund and Health Foundation have picked them out and bullet pointers for them, because I'm not seeing bullet points within most sections of their main manifesto, which is interesting. What do you think about Labour's manifesto?
So I agree. I tried to kind of figure out where's the key points and stuff, and that was challenging to do. I think it is more of a conversation piece, though, which I think some people will appreciate. And I hadn't thought about the metric side of things that you just pointed out, that the fact that because it's a website based, absolutely, they can get more data in terms of how people interact with it to inform what people are focusing on. But also for future years, it's an interesting idea.
Yeah, they could do the bit of A/B testing and try different things out, and lots of interesting things you can do if you move to a website. I suppose it's worth having a look at the other parties as well. So we've got the Liberal Democrats, Fair Deal. So what have you had a look at this one, Gandhi? What did you think? I spent a little bit of time with it.
So similarly, it's a website based rather than a PDF. There may be a PDF. We just struggle to find it. When you click on the individual sections, it opens up a shortened version, and then you can click on a more detailed version, which does give you a lot more detail. So if you look at the health one, if you click on that health one, it's about the size of an A4 sheet of paper, which is actually, I think, quite a good way of presenting information. You want short and sweet for most people to comprehend. And then if you want the detail, you can click on the next part, which then definitely gives you the detail for the Lib Dem one. It's much more detailed, much more expansive and stuff. And I think I counted about 4 pages of A4, which is similar in size to actually the Tory version in terms of their policies and stuff, and definitely has a lot more detail in it. Costings and stuff don't really come into play. Cross-referencing is a bit more challenging to do, so I very much appreciate, again, like you said, the Health Foundation and the King's Fund having done some of that work for us, which you'll see in a second. And this is definitely in contrast to the other two parties. So you've brought up the Reform Party one. What do you think, Andy?
Yeah, it's a PDF like the Conservative
Hmm.
manifesto. And I mean, to be honest, actually, in terms of it's not terribly long. How many
Hmm.
pages are we? It's about 28 pages. And it's actually quite readable. I quite like the presentation um, of the sections. Things are in bold, things are bullet pointed. There's graphics, and they break out information. So actually, as a document, it's quite readable. What were your
Hmm.
impressions?
Yep, easy to read, much simpler in terms of basis. Not clickable, so you still have to scroll around and stuff. The health section is basically half a page of A4 because half of it
Yep.
is taken up by a photo, but it is easy and simple to read, which is good, really, in that sense. We'll come to the content in a second. I have to admit, the one I didn't like the most was the Greens. I found this one the hardest to take information from. So I can see that you're sharing it on here. So they've got a main website, it takes to the various different sections. The
Yep.
health one, we haven't looked at the other sections, so you would potentially envisage that the Greens stuff on renewable aspects and environment and stuff will probably be a lot more detailed. But I found this one the hardest one to take information from, to be honest.
Yeah, I think so. And it's quite sort of fairly narrow in terms of the focus, in terms of the areas
Hmm.
it chooses to focus on. So, but I guess those are the manifestos. We've got the links,
Hmm.
I think, below in the show notes, and really encourage
Yep.
people to pick them up and engage with them. Look at the other sections as well, because the other thing is as well, I think they have to be taken in their entirety as well. We'll probably talk about how deliverable some of the promises are and how affordable some of the promises are, but obviously
Hmm.
the commitments and the spending and the pledges are only one side of the coin, and actually how are these going to be paid for is also an important consideration in terms of how credible and
Hmm.
deliverable these things are. And a lot of that detail is often in the other sections, looking at economy and taxation and
Yeah,
things like that.
absolutely.
Um,
So we're going to have a look at the King's Fund document. So for those of you joining us live, I am just putting the link to that in the chat right now. Alternately, as Andy mentioned, it is in the show notes as well. So if you're watching us on the replay, just click down below and you'll be able to get to those, and that will give you the links to this particular page that you can see on screen now. So the King's Fund have split up the three main parties' policies into different sections. We will try our best to add in the other two as we go along, but we'll probably summarise them more towards the end, to be honest, and stuff. And they've done a pretty decent analysis. I think the Health Foundations is just as good, but we just picked the King's Fund because it's slightly more colourful, I think.
Yeah, and I'd give a shout out to the Health Foundation. They've done two. So one of them looks at what the Party Manifesto say about health and care, and then they've done another one which it could even be an episode in itself. Gandhi, looking
Hmm.
at building good health. So this is looking at the wider determinants of health and how other parts
Hmm.
of the manifesto impact the wider determinants of health, like work, environment, housing, transport, things like that. So services for young people. So that's really
And I
interesting
think
and worth a
potentially
look.
for PCNs, that's a really good resource because actually it summarises a lot of the party policies, like you say, in terms of the wider impacts of health on your local population. Actually, there may be some things to take from that to work within your local networks or your ICBs and stuff. So a little bit of a tip there for you all.
And
But
of
yeah,
course, people are
yeah.
watching, aren't they? So please do comment as well.
Hmm.
We are trying to keep this an apolitical space, looking at the policy. But obviously, people, you're very welcome to make comments. Try and keep it, well-meaning and so forth. But really
Hmm.
interested to get interactive with people.
And those of you that are watching us on YouTube, you are welcome to take part in the vote that I've put in terms of which of the policy, who do you think has the best health manifesto now that we've shown you them all and stuff. So let us know in the vote as well. And we'll come to that a bit later on. However, right now, let's start talking about the policies themselves. So first up, we've got social care reform, which, let's be clear, health is inextricably linked with social care. Because if you don't have good social care, you can't really have good health because where does everybody go and how do we keep them out of hospital and stuff, which is one of the key challenges right now. So what do you think from the social care reform from the King's Fund, Andy?
Yeah, so I think let's just look at the kind of number of pledges and kind of the focus that's been given in each people's manifestos, with probably more attention being given to this section in the Labour manifesto.
Hmm.
I would say, and also the Liberal Democrats are quite strong on social care as well. Um, it's there's quite a lot there, isn't there?
Hmm.
But of course, the devil's in the detail, really, in terms of what these actually mean when they're implemented. Labour undertake a programme for reform to create a national care service. That sounds like potentially pretty huge, doesn't it?
Yeah,
Something similar
massive.
to the NHS, perhaps, but difficult to know exactly what they're envisaging with that. New standards to improve consistency of care across care homes and care environments in the country. Closer local partnerships with NHS around hospital discharges. So there's quite a lot there in
Hmm.
the Labour manifesto. Similar promises in the Lib Dems. I think with the Lib Dems, the one that caught my eye is create a national care agency to set national minimum standards of care. So that's quite a big undertaking, similar to Labour, I
Hmm.
guess. We're seeing very similar things here. I had heard some talk about like a higher national minimum wage for carers and things like that, I think, from the Liberal Democrats, but I don't think that's made it.
Hmm.
Correct us if we're wrong, but I don't think that's made it into the manifesto. What did you think about this section?
I mean, they're quite varied as well. That's one of the key. There's not really much blend over if you compare, for example, the Tories and
Mm,
some of the stuff is there. So they both Labour and Lib Dems talk about similarly having a national kind of organisation take over things and minimum standards and that kind of stuff. But apart from that, there's not really a huge amount of blend over and things. The Labour Party is the only one that actually talks about its link with the NHS as well. So develop a local partnership between the NHS and social care sector on hospital discharges, which for many of us working in healthcare know that the key challenge that we actually have right now is getting patients out of hospital in a timely fashion and keeping them at home in a safe and productive way, because actually social care is so challenged in terms of its resources to support patients when they come out of hospital. And actually, if we did got that right, we would have more potential bed capacity, which would then have better impact on obviously flow for patients through hospitals themselves. So,
yeah.
um, you know, it's interesting from that point of view. I
The
thought,
thing as well, that so the cost of social care is a big issue, isn't it?
yes.
And the Conservatives and the Liberal Dems sort of both address this in slightly different ways. The Conservatives are proposing a cap to the cost for social care that individuals pay, and the Liberal Democrats are suggesting that some aspects of personal care may be covered by the state and free to
Mhm,
the individual, which feel they're different ways of doing something that feels quite similar. I
mhm,
don't think that Labour are making similar pledges, which is interesting.
mhm,
You might expect Labour to make some pledges like that, given where they're coming from and their background as a party. So, but that's interesting.
mhm.
Shall we have a look at some of the other sections and move forwards? There's
Yeah.
quite a lot of different sections, so we probably need to move through at a fair clip, I guess. And again, really interested to know what people have made of the manifestos, the promises and the pledges. So,
Mhm,
access to hospital care. So, this is going to be a big area for a lot of people. Conservatives, so the return performance levels to those set out in the NHS constitution, and I
mhm,
didn't have a chance to dig into the NHS constitution actually to see what performance
mhm.
levels were actually set. I don't know if you're
No,
aware of any specific performance levels.
no, I'm not. I must admit. So, if somebody out there watching us can tell us, feel free to do so. Um, but it's a bit thin, if I'm being honest. I expected a little bit more from the Tories in this one.
Yeah, yeah. I mean, I think they are looking at the actual document itself, and maybe it comes later in this analysis. I think it might do. They are talking
Mhm,
about opening community diagnostic hubs, and I think 40 new ones of those, and things like that.
mhm,
I think some of these are already in the pipeline. I know that one will be opening in Nottingham anyway, so they do make perhaps some additional um, pledges around that. Labour are talking about providing 40,000 more appointments, operations, and scans. I mean, by the time you're
mhm,
getting to operations and scans and appointments, I'm not quite sure how much of a difference 40,000 is.
mhm.
What's the numerator? How many appointments, operations, and scans occur every week? It may be that that's not a great deal, but 1 billion pledged to do that. So I think the NHS budget is it about 150, 170 billion,
About that, yeah.
Gandhi. So that's probably less than 1% um, increase in the total budget to deliver that.
Mhm,
A return to meeting NHS performance standards. So things like 18-week wait for outpatient appointments and so forth, which Okay, that's interesting. And they talk about using spare capacity in the independent health sector to bring down waiting lists. So that's using the private sector to
Mm-hmm.
do work for the NHS, which is something that happens already.
Mm-hmm.
It talks about using spare capacity. I don't know how much spare capacity there is in the private sector that's not already being used by the NHS. I don't know. It might be that there is spare capacity. So
Mm-hmm.
that's certainly more specific pledges than Labour there. And then the Liberal Democrats are talking about 1,000 new beds, investment for any departments. And they talk about how to pay for it, actually. Upfront capital investment of, no, they talk about how much money they are going to use to pay for it, not
Mm-hmm.
necessarily where that money comes from. Correction, sorry. 280 million to expand urgent treatment centres, 400 million per year to staff the new hospital beds. And they're going to publish ambulance response times locally. And I guess other areas of the NHS do have their performance published.
Mm-hmm.
There's a lot of information out there about GP access, waiting times in
Yep.
terms of days for appointments, and numbers and types of appointments. So that would be something similar for the ambulance service. Thoughts, Gandhi?
So interesting stuff. Like I said, the Tory one seemed a little bit thin. In my view, it was just return to what we were doing before, which doesn't sound really very bold and stuff. But
It's
I
not
think
that
you're right.
inspirational, is it? But
Yeah, but I think, like you say, some of that's incorporated in some of the later stuff that we're going to cover. The Labour one is interesting in terms of the spare capacity in the independent health sector, because guess which party is the only other one to mention that?
is it reform?
It is Reform,
Yes,
yeah.
I thought it
So
was.
so
So
actually,
yeah.
aligning of principles and policies, it is unusual to see between those two parties, but they're the only two that actually talk about using the independent sector. Reform go much deeper into it, and almost in a sense looking at creating a different port of access and stuff. Um, and we'll come to the reform policies a bit
Yeah.
later on. So do stick around if you want to see those, because you may or may not do. Um, but that was the thing that jumped out to me and stuff in terms of how that works. I mean, 40,000 appointments sounds like a lot, but when you factor that into what the NHS has lost, actually, I think that only brings us back towards what capacity should have been, to be honest.
Mm.
And obviously, a lot of that's been bogged down because of successive challenges, because of obviously COVID, the strikes, and various other things that mean that actually you probably need that just to get us back towards normality, let alone catch up. But again, we're
Yeah.
not
If
health
anyone out there
policymakers.
knows how many appointments, operations and scans the NHS does per week, let us know.
Mm,
Probably a quick Google might be easier for one of you guys to do it. Let us know if you're near your cursor and can Google that for us in terms of how big a impact that 1 billion will make,
okay.
and how big an impact that 40,000 additional appointments will make. Something that's already striking me about these pledges, Gandhi, and when I was reading the
Mm-hmm.
documents, is you could almost take any single sort of pledge and make it, and they could come from any of the parties.
Mm-hmm.
They're all quite similar in
Yeah.
terms of the types of pledges that are made. And that's really interesting. And even some of the reform pledges, you might look at some of those and think, actually, that's quite reasonable. And that could have very much come from Labour or the Conservatives or
Mm-hmm.
even the Greens, to be honest. So interesting. Access to primary and community healthcare. So this, I guess, is us and our audience
Yeah.
in terms of general practice. Yeah. So this is where the community diagnostic centres come in. So yeah, build 50 more community diagnostic centres. I don't know whether that's in addition to those that are already set to open or not. Build or modernise. It strikes me it's probably a lot easier to say you've modernised something than say you've built it. 250 GP surgeries. Focus on areas with new housing growth. So that's interesting, because we have a lot of
Mm-hmm.
inner city apartment building, don't we, in Nottingham City? And there's often the challenge that the authorities don't plan for increased increased
True.
GP capacity that might be required. So it's interesting that that's been picked up.
Although it does raise the question, does new mean new builds as in brand new, or redevelopments, which is what often a lot of the inner city challenges are in terms of how they
New
work
housing
as well.
growth is what it says.
Mm,
I don't know.
yeah.
So that's interesting. They're expanding Pharmacy First clearer. I think the jury's probably out in terms of how Pharmacy First is landing at the moment, although in principle it feels like a good idea. So if implemented well, that's positive. Invest proportionally more in out-of-hospital services over time. And I think that's something that hasn't happened over the past
Mm-hmm.
5 to 10 years. So that's interesting.
Mm-hmm.
Labour are going to train thousands more GPs, and guarantee a face-to-face appointment for everyone that wants one. Wants, not needs, wants.
Yeah.
And guarantee. So that's interesting.
Strong word. Yeah.
Yeah. Deliver a modern appointment booking system. I don't know quite what that means, and some might argue that with modern general practice implemented in last year's contract imposition, we took some steps towards that anyway. Bring back the family doctor, incentivize GPs to ensure people always see the same GP. What do you think?
We'll come back to that.
Okay, we're going to come back to that one. Okay, fine. Increase community pharmacist prescribing and produce a community pharmacy prescribing service. Give them more prescribing rights. Allow other professionals such as opticians to make direct referrals to specialist services and tests, and self-referral routes where appropriate. Now, it feels like they've talked to some GPs here, because a lot of GPs will say, oh, the GOS 18 that comes from opticians that basically says, we've identified a problem. Could you just do the paperwork to forward this bit of paper to the hospital? That it often seems quite illogical that that's necessary. So it feels like they've spoken to some GPs somewhere in writing the manifesto. I'm sure all the parties have, because that really speaks to a specific problem that GPs have. Trial neighbourhood health centres, bringing together community services. Sounds quite PCN-like in a way, and I know a lot of PCNs are beginning to do these sorts of hubs. That's interesting. And a neighbourhood health service. So NHS, the same letters, neighbourhood health service.
Maybe a bit little NHS, little N, little H, little S.
Oh, you're already onto the branding. I like it. And shifting resources to primary and community care over time. So again, it feels like they've spoken to people who probably have the right idea about shifting worker funding closer to patients. So that's interesting. And then the Liberal Democrats, similar to Labour in a way, but give everyone the legal right to see a GP within 7 days or 24 hours if urgent need. This is where thinking about how things are funded and how realistic things are begins to become important to me, actually, because if I was a patient, I guess something like that sounds really, really positive. I think legal right, you think, okay, so who's the legal action going to be taken against, and how, and what are the penalties or the compensation, or actually what does that mean, and is it the ICB who are going to be responsible for making sure there's enough appointments, or is it individual GPs and individual GP partners who are going to be taken to court by their patients, and are they going to stay in the game if that's the case, or hand back contracts and reduce the availability of GP services? In doing that, who decides if it's urgent and they need to be seen in 24 hours? Is that the patient? Is that the practice? It becomes very, very difficult to think about how some of these more complicated policies might actually be implemented. So things like that sort of make me pause for thought, really. Give everyone over 70 with a long-term condition access to a named GP. Feels like we've been here before, right? Everyone has a named GP anyway. Interesting.
I mean, that's a rehash of the unplanned admission deaths brought in by Jeremy Hunt about 10 years ago and stuff. So the thing that slightly concerns me with that is the capacity that they mentioned. So everyone over 70 is a reasonable amount of people, but with a long-term health condition. Most people now have a long-term health condition, so that makes it very challenging. And actually, I would argue a lot of the evidence around long-term health condition management is actually other people are better at doing that than GPs, to be honest, in terms of maintaining routine healthcare for that side of things. Actually, our nursing team, our AHP teams are probably better at it than GPs.
And what does access mean? Anyway, does that mean you can get a message to them? You can get access to them through another member of the team if needed. So the devil would be in the detail with all of these things, really. Strategic Small Surgeries Fund, that's interesting, isn't it, to sustain services in rural and remote areas?
And they're the only party that make mention of something along those lines as well, and that includes the Reform and Greens. So no other party makes a comment around those in their manifesto.
Yeah, a universal booking system for general practice. That sounds like an enormous undertaking, and you can start to see all sorts of problems in the implementation of that, given that the GP sector is kind of lots of small independent businesses. Actually knitting all of that together feels like actually an enormous undertaking. fairer, more sustainable long-term funding model for pharmacies. I don't know what that would be. The words fairer and sustainable sound positive, and working toward sounds, achievable. Build on the pharmacy first approach. So many of the parties are talking about that as a way of taking pressure away from GPs, and greater prescribing rights, and basically empowering allied health professionals to free up GP time, which already happens to some extent. So that's good. Did you have anything in particular? I know you said, "Oh, we'll come back to which one was it? It was one of the. Was it one of the Labour?
Yeah.
Did you want to come back to that now, or were you?
So, I mean, it's the first three on Labour that seem interesting to me. So, train thousands more GPs and guarantee face-to-face appointment for everyone that wants one. I mean, the logistical challenges of making that happen are immense. And then when you combine that with the third one about bringing back the family doctor by incentivizing GPs to ensure people always see the same GP, I just cannot imagine how you can make both of those two things a guaranteed promise. Because to guarantee a face-to-face appointment with any patient that wants to see a GP, and it be the same GP that they see, that would basically mean GPs are working 24/7, because that's the only way you can guarantee those two things. And let me be clear, GPs will not do that. Many of us are already working significantly over our anticipated hours or expected hours and stuff. And it's one of the reasons why we're losing GPs working left, right, and centre. So then trying to combine, it's the combination of the two that really confuses me, because they're at odds and don't make sense from any form of well-being for the individual clinicians trying to deliver that in any way, shape, or form.
Yeah, it's almost an oxymoron, isn't it? You kind of can't. It just can't exist.
Now,
yeah.
if that had said primary care team, actually, that would have been completely feasible and manageable. It's the fact that, again, they've used the specific word GP of the role versus GP of the practice. And I think that's the key thing that sticks out from a lot of these policies.
They say face-to-face appointment. They don't specifically say GP appointment, although I would argue that it's implicit within the sentence.
It is.
But you could interpret that sentence as just any sort of appointment. But it's face-to-face rather than telephone or remote. So they are being specific about that, at least with the appointment. So so interesting bag. And again, there is quite a lot of overlap, really. What I would say is in Labour's manifesto, there's actually no specific numbers anywhere within it. The other pledges do have some specific numbers, in there at least. So interesting. Dentistry, not an area that we.
Sorry, can we just go back to? Sorry, Andy, a couple more points on Labour.
Of course.
Yeah,
this is the main area for us.
Yeah. So I guess the other thing, looking at the Lib Dem ones, it talks about the greater prescribing rights and public health advice who will be given qualified pharmacists, etc. and stuff. One of the things that is actually in the detail, so I did have a look at those in a little bit more detail. I believe they're one of the only parties as well that talk about reform to the prescription service that currently happens. So they mentioned and you can't see it here because it is in the more detailed version, but it was about making prescriptions for patients with mental health challenges free, because actually currently that's not an exemption. Which I actually think is a really sensible idea, because those are the patients that struggle, and actually if they don't take their medications, they struggle even more. And if they can't afford to take them because they're struggling, then it's just that catastrophic cycle. But specifically, they're the only party that talked about prescription reform, which is something I know I'm quite passionate about, because I think the prescription system in England is absolutely atrocious in terms of the exclusions and stuff. It hasn't had any form of reform for over 30 years, I think, in terms of a significant basis. So, it's an interesting thing that they are the only party that talked about looking at that. I think going back to the Tories, I just don't see anything in there about general practice, if I'm being brutally honest. Building or modernising 250 GPs. They could easily say they've modernised 250 GP surgeries just by saying that we put a new board on the reception desk, and job's done. I'm slightly cynical of that particular one, given what we've heard previously from their modernising plans of hospitals. They said previously, I think they were going to create 40 new hospitals, and actually, when you looked at the data, it was just revamping about 20 odd or so. And apologies if I got the numbers wrong, because I probably have. But it was something along those lines, and they'd actually only built about 4 or 5 new hospitals across the whole country. So I thought there'd be more. I really did.
Yeah, they're probably the thinnest in terms of promises. But also we're saying that some of the things don't feel sort of realistic or well thought out in some of the manifestos as well. So just adding a
Definitely.
bit of balance there, because things have to be deliverable, within the economic envelope of the country as well. And we do often complain about governments over promising in terms of what the NHS will deliver, and then under delivering, and actually the staff are the people who often end up with the ire of the public in those situations. So,
and in that effort of balance, Labour commenting about creating a community pharmacist prescribing service. I mean, we've just had a brand new one start this year, Pharmacy First. I don't understand why they haven't said, just like the Lib Dems have and the Tories have said, that they just build on Pharmacy First. Why do you need to rebrand it again and waste money rebranding it again?
I don't know. Okay.
Fair enough. Okay, let's move on to something that they all agree on, bizarrely. So the parties have all agreed on one thing: they need to change the access to dentistry.
Yes.
So yeah.
What did you make of these ones then, Gandhi?
So they all talk significantly about increasing access to dentistry. I think everyone recognises that public access to dentistry is not great in the UK, and especially in England. So Tories talk about providing 2.5 million more dental appointments through a dental recovery plan. Okay, we haven't really seen what the plan looks like. Golden laws to encourage dentists to work in rural and coastal communities, plus new dental vans to take dentists to the surgeries and to isolated underserved communities. That is not a bad idea. I haven't seen the costings, obviously, but fair enough. Labour said they will reform the dental contracts with a shift focusing on preventative care and retention of NHS dentists. I'd argue what NHS dentists? The problem is not retaining them is absolutely a challenge, but actually the bigger challenge is
recruitment.
It's recruiting. They have the different problem. Recruitment is not the issue in dentistry. There's loads of dentists around. The challenge is they're all currently working private because of successively poor contracts and mechanisms that mean that it's not financially sustainable for many dentists to offer NHS contracts. So about 125 million for dentistry package includes 700,000 urgent appointments every year, 100 of which would be for children. Okay, nice to see they're prioritising children, because we know that dental health, if you focus on the earlier ages, makes a difference.
And if you listen to Keir Starmer talk, he's often talking about children's teeth. That's been a feature of him in the election. He keeps returning to children's teeth. So obviously, and it's important actually. And actually, in Bulwell, actually, when we looked at things that affect the population, actually, children's teeth does come up as a significant issue. And there's been various sort of tooth, cleaning teeth at school, and all sorts of things brought in our area to try and improve the quality of people's teeth. And I think if you look at the state of dental care of children admitted to hospital, I forget the statistics, but a shocking number, have cavities and very poor dental health. So it's probably right to focus on that area.
Interestingly, the King's Fund haven't commented on one of Labour's policies, is probably what we should be talking, which is effectively that. So was it joint brushing between the ages of 3 and 5 in schools and stuff? So that is one of their kind of commitments or policies, if you want to call it that way. That's not included in the King's Fund commentary. I don't know if it's going to come later. I can't remember if it comes later down and stuff and things. Lib Dems, in a different, again, they seem to be the most fleshed out on this one. So they guarantee access to NHS dentists for everyone needing urgent emergency care. Again, bold statements. Interesting to see how they make that happen. Bring back dentists to the NHS from private sector by fixing the NHS dental contract and using flexible commissioning to meet patients' needs. I'll be honest, they have nice ideas. I think they're going to have to go a lot stronger, though, if they want to convince private dentistry to come back to NHS. They're going to have to actually make doing NHS dentistry more attractive or a legal requirement. Those are the only two ways they're going to make it happen. And I'm not sure any of the parties actually address that aspect of stuff. The
Liberal Democrats, again, they're making a guarantee. It's almost like the guarantee to see your GP as well. If you're being cynical, you sort of think it's it's easier to make very bold statements if you're less likely to have to implement them. And it's probably, it's no secret that the Liberal Democrats are not front runners to take control of the government in the next election. So they perhaps have more freedom to be more free thinking. And I think there's a role for that, because often, policies that turn up in one party's manifesto in one election, actually get adopted by other parties later on. And actually, I think with some of the more smaller parties' manifestos, I think that's something that we're seeing. There's some very interesting ideas, but not necessarily delivered with the same obligation to say how they will be funded, I think I would say. But good ideas. Yeah.
And then the last two about trying to guarantee, again, appointments for people for those in need, in particular children, new mothers, and those who are pregnant on low incomes, and also those patients needing checks before they have particular operative or treatment options that require them to have a dental check beforehand, of which things like chemotherapy and surgery are a sensible one to do, because obviously that can impact it and stuff.
Yeah. I mean, so that all sounds fantastic, actually.
It does. Yeah.
Yeah, it all sounds great. But you sort of, I guess we're maybe becoming old cynics, Gandhi, in terms of we start to think, actually, is that affordable? Is that deliverable? How do you get the dentists to actually come away from their private work and start delivering those things at the sort of tariffs that the NHS is likely to be able to afford? It's but with enough will and enough focus, that should be and enough money, that should be deliverable.
So just before we go to talk on about how they're going to do it, I guess one of the things we wanted to point out is that we have over 100 live viewers joining us right now. So thank you, everybody, for doing so. If you do want to comment and help us in this discussion, please feel free to do so. What parts of the policy that you've seen so far are actually, something that you think that's good, that's not good, etc. and stuff, and absolutely tell us how you're thinking about it as well in terms of what you think may work. And also,
so subscribe, make sure you click all the notifications, as well as the notify me for the video. It'd be great if you could like it, share it with your colleagues, and then if you want to see more details, click on more down below.
And if you are watching us live, I've put the link to subscribe in the chat as well, so that makes it even easier for you to do so you can see all this content moving forward. But right now, we are going to talk about how they plan on doing this, and that's with the additional funding commitments, which is interesting, isn't it, Andy?
Yeah, it's interesting. Really so what have we got there? So they're quite a brief section, actually. So the Conservatives increase energy spending above inflation each year for the next Parliament. So, okay, that's fine. I mean, I guess that's CPI inflation, not necessarily the rate of healthcare inflation, which is normally higher than standard consumer price index inflation, but okay. 1.7 billion a year by 2029 to fund pharmacy first and those diagnostic centres that they've talked about and mental health services. So, okay, that's a figure on it. Labour, 1 billion to fund 40,000 more operation scans. So we talked about those new scans that are coming, and I think the 1 billion did come earlier as well. We did get the 125 for the dentistry package as well. That came earlier as well. And 410 million pounds to recruit 8,500 new mental health staff. There's a hyperlink there, which I'm not going to click, but presumably that'll link to some more details about who those staff will be and what they will be doing. But that's quite a sizable investment in mental health services, actually, probably 1/3 of the total money that they're pledging, and that all adds up to a very similar amount to the 1.7, doesn't it? It's about 1.5 something, so similar amount. Liberal Democrats, bigger spenders, 3.7 billion a year increased in day-to-day NHS spending. So that's a simple figure and is sort of 2 to 3 times what the other parties are pledging. So, and I'm sure some people have got their calculators out, tried to work out, whether this fully covers the cost of the plans. That's not something that we've done, and I don't think that's something that's done within this document either. But I guess people can make their own judgments about that. So, capital investment, new NHS buildings. So, continue the plan to deliver 40 new hospitals by 2030. So,
all right. I shouldn't laugh, but yeah. But they do also commit to spending 3.4 billion in new technology delivered through the new NHS productivity plan. I mean, that's quite a chunk of money. 3.4 billion is
Yeah.
eye-watering.
One wonders how much of this has already been spent. We've been looking at these things already, haven't we? And these figures sometimes include, particularly from people who are already in power. We've found that they often recycle money that's already been pledged or spent. I've not looked into it. That might not be the case for this figure. Feels a lot, and it's actually more than the annual increase in NHS spending that they intend to spend, which was just 1.7 billion, wasn't it? So that's an awful lot of technology. So Labour, 250 million pounds, which is not an enormous amount of money, to double the number of CT and MRI scanners. It'd be interesting to know if that's enough money to do that. That feels like it might not be. Or that might, I guess we're talking capital costs, so that's not necessarily actually the staff to run them and the training for those.
It's just the machinery.
It's just the machinery. So maybe I'm sure they've done some figures to justify those. And deliver the new hospitals program. Again, it's a hyperlink. I'm not quite sure what's behind that hyperlink, but they're also talking about.
So I think that was to build their 50 new hospitals or something that they said, wasn't it? In the earlier thing. No, that was the Tories that said 50 community
50 community diagnostic centres. They're doing 40.
No, that was the Tories. No, that was the Tories and 40 hospitals. Yeah. So, but yeah, effectively, it was a modernisation plan for a lot of the hospitals and stuff that exist and things.
Okay.
Lib Dems, by contrast, implement a 10-year plan to invest in hospitals and primary care estates. So nice. I guess some love to both sides.
And improving NHS buildings and equipment, 1.1 billion. So it's good. It's difficult, isn't it, going through all of these to kind of get your head around? And I guess a large part of my judgment here is actually thinking what sounds like a good idea and what actually sounds sensible and deliverable as someone who works in healthcare. And then do you think that matches the funding, and does the whole package kind of stack up? Is the process just to outline the process I'm kind of going through in my head here? So social care funding. So social care is really, obviously really, really, really vital and important in its own right, and to how the NHS functions as well, because when the social care sector isn't working right, that's when people cannot be discharged from hospital. That's when hospitals are full. That's when new people coming in ambulances cannot go into the hospital because there are not beds. So really, really important for the flow of people through the NHS. And of course, good care keeps people well and keeps people out of hospitals. It's really, really important.
And for such an important part, it's pretty sparse. But effectively what they're saying is that we will review this at the next spending review. Both for the Tories and Labour have pretty much said a similar thing. We will make a 5-year, I think, was it 5-year plan or multiple year plan for a spending review, whereas the Lib Dems, the only ones who actually put money figures on the thing, spend an extra 3.7 billion a year on social care. They like their 3.7 billion.
I was going to say that's a familiar figure, isn't it, for the Liberal Democrats? And of course, in terms of what they were doing around social care, that was one of the first areas that we covered in this document as well. People can jog back to that or have a look at the link, which is in the links below. Workforce recruitment and training. So there are a lot of numbers here in the Conservatives one, and I think that's because they put the NHS long-term workforce plan out that we covered in detail, several months ago, and was really quite ambitious in terms of the scoping of increasing training places and numbers of all sorts of types of staff. In particular, I think GP training places were increased by a third, I think, or I think there was like an additional 50%. GP training places, for example, many more nursing places. So it's very, very ambitious, and they are drawing on those projections to give them their numbers, and reduce the number of managers in the NHS by 5,500, releasing 550 million for frontline services. Yeah, I don't know. It feels like it's something you often hear, isn't it? Reduce management. And I think we've been hearing that for years and years. It's not to say there aren't, additional efficiencies that can be made, but the NHS does need managing, and needs managing effectively as well. Otherwise, you actually don't get the most from the frontline staff, because they end up having to do the managing themselves, and it pulls them away from their caring and their, medical and clinical roles. So it'd be interesting to know what people think about whether there is
I think it was in the Health
those
Foundation
efficiencies.
stuff, they actually commented that some recent reviews have shown that actually England in particular has the least spend on management per capita of healthcare compared to the other European countries. So even though they identify this as being a problem, it's probably not as much of a problem as we think it is in the grand scheme of healthcare in itself and stuff.
These sort of things sound good, don't they? Potentially, you know, cut red tape, cut management, but sometimes you need better management to make things run more efficiently. So Labour, I guess this is where they're pledged to recruit another 8,500 mental health staff come in. That's one of the workforce commitments. They commit to delivering the NHS long-term workforce plan. So they want to do that as well. It's nice to see something come along actually, and both main parties actually agree to continue it. That gives some continuity in terms of planning, which I think is a nice, sensible thing to see. Ensure the publication of regular independent workforce planning across health and social care. So I really, really like that. I like the word independent and I like the word regular. Really, really good. It'd be interesting to see who they're going to ask to do that, whether it's Office of Budget Responsibility, Office of National Statistics, or a new body, or or if they commission someone like the King's Fund, to do that sort of work. But that would be really, really good, because to make workforce planning not political would be really, really great, I think.
Yeah.
So that'd be fantastic.
Agree.
I'd like to see that for other areas of the healthcare policy, probably as well. And they want to establish a fair pay agreement in social care, collective agreement with the sector to set fair pay terms and conditions. So that's interesting. And again, I don't think it made it into manifestos, but I had heard talk of a increased minimum wage for the care sector, and this maybe sounds like a slightly watered down version of that. But what would be your reaction to that, Gandhi? Because I know what my first thoughts were.
I think the question is, where's the money going to come from, actually, more than anything else. So I agree. If you is that cartelling in some ways? How does that work? But if it's a nationally agreed level, it probably isn't. But at the same time, how it's one of those inevitable questions. If you set a minimum standard, how do you make that equitable for other people as well? Then, if you're saying that where's the boundary of social care? Is that the people that then do the cleaning for social situations and stuff as well? So then you have to expand it to cleaners, which is not a bad thing to do necessarily. But then the question is, how wide is that scope as well? What do you quantify and things? So it's an interesting proposal.
Yeah, and I was thinking it increases the cost of delivering social care, doesn't it? And a lot of the care companies that deliver care, just really struggle to actually function. So I thought actually it sounds good, and it would be, good for those workers. But a concern people have about minimum wage policies in general, is actually, does that make the delivery of the actual service, not cost effective? And how will you do that? Will the government top up the money, with some sort of credit, or it's interesting. But I guess they're going to establish, right? So they're going to decide what that is afterwards, when that might be sensible, because they can land somewhere achievable with that. And Liberal Democrats increased the number of full-time equivalent GPs by 8,000. So by retaining and by recruiting more GPs. So that's great.
Okay.
Need to pay people to be able to employ them. That's something that needs to happen. So solve the GP workforce crisis that we're experiencing, where there isn't money to pay the GPs that are trained. So hopefully that will be dealt with as well. Flexible staff banks to reduce spending on agency workers. Okay. Encourage. I mean, I think we'd all, want to do that anyway. So the word encourage is quite gentle, I think. Bring forward the social care workforce plan, focus on recruiting more staff to the sector. This is where it was the Liberal Democrats manifesto. So create a new carers minimum wage, boosting the minimum wage for care workers by £2 an hour as a starting point for improved pay across the sector. And that sounds really good, but again, the cynic in me thinks actually is that deliverable, and where does the money come from, essentially. So and is actually that basically, is that just going to be paid for by local authorities, by people who pay for their care or their family's care, and is that what people want. Although it's a very difficult job and it does deserve more money. And sat here on another day, we'd be saying, we'd be saying that a lot, wouldn't we? And with enthusiasm, that people are not paid enough for the job that they do. But I guess at the moment we're looking at it through the lens of kind of deliverability as well as desirability, and I just kind of wonder how feasible that is. The money needs to come from somewhere. So, but interesting.
Yeah. So recognizing we're about halfway through, we probably need to crack
Can we speed
on
up? I mean, we've probably done some of the main bits, haven't we? So we can maybe, and we do need to look at the reform and the Greens, because there are some good, interesting, shall I say, things in there. So shall we pick our battles as we go forwards, Gandhi?
I think the next section we definitely need to have a look at is the support for NHS and social care staff itself. Some of this has already blended over. So the Tories one is very broad. Again, improve working conditions for all NHS staff. I mean, yeah.
Great.
Great. Consider the implications of the review whistleblowing framework and consult a disparaging regime for disbarring regime for NHS managers. I think this is probably about more accountability, because we have seen in the past some NHS managers in higher up positions being able to jump from place to place. Again, I think this is picking out a small issue in a different way. I don't know.
Disbarring. Exclude from something. So that will be people losing their job, I think. So
Labour talk about resetting relations with NHS staff and moving away from the current approach on strikes. Interesting. Implement professional standards and regulation for NHS managers. So both parties talk about that. And establish a Royal College of Clinical Leadership to champion the voice of clinicians. Confused is my face on that one, to be honest.
We have Royal Colleges who represent clinicians. They're perhaps, although that's not necessarily their role, because we also have a trade union that exists and is the trade union for medics, or the main trade union for medics.
Exactly.
What does that mean?
I don't know. Lib Dems implement a 10-year retention plan for the NHS staff. I mean, I would argue that's what the workforce plan that came out last year is meant to be. So why spend loads of money on another plan?
Although we said that was a lot about recruitment, but not much about retention.
True. Fair point on that. Make flexible work in the NHS a one-day right and expand access to flexible, affordable healthcare, childcare. I mean, I know many of our colleagues would be very keen to have that enshrined in terms of the regulations and stuff. And I think that'd be really powerful if it was able to do. Definitely. Introduce truly independent complaints process and transparent monitoring of reports of sexual misconduct in the NHS. Sounds sensible. There's so many organisations involved in complaints, though. So I think if that was the case, I would want to see some of the other ones not exist as a result of that. If you've got a completely independent, but what does completely independent therefore mean? Create a clear career ladder to allow flexibility to work across the NHS and social care. Okay.
Yeah, sounds good, doesn't it? Quite what that means, whether that's transferable qualifications for managers and care and specific care skills. That might actually be reasonable, and you can think about how you could begin to implement that sort of stuff. So I think that's actually quite interesting for me actually as well. Create a Royal College of Care Workers to represent the care workforce. I actually quite like that idea.
And that sounds better, to be honest with me, than the Labour version, because I didn't quite understand the Labour one in the same context, to be honest.
I think clinicians already have apparatus to exercise voice, I think. Whether it's listened to or not enough is the question. But certainly something for representation and standards in care work, I think would be great, and to bring some prestige to that area as well. So actually really, really like that. And, that might be something that maybe gets picked up later by another party as well. And, not necessarily something that might cost an enormous amount of money, small individual membership, or, some revenues from providing qualifications. You can see how that could be made to happen. International recruitment and migration. Okay. So I was in hospital recently, and a lot of people that looked after me, were clearly, international medical graduates or, non-medical staff coming from overseas. So there's just, absolutely vital to the functioning of the NHS are people that come from overseas. So the Conservatives introduce a binding legal cap on migration. So that's one thing. And health checks before traveling to the UK. Increased immigration health surcharge. So this is talking about access to people to the NHS, people coming outside, asking them to pay more and have health insurance to cover things provided on the NHS. it depends how that's implemented. I can see that might be attractive to some people. I don't know quite how much money is lost in air quotes to the NHS through that activity anyway, and whether that's a large saving area if they clamp down. Okay. Interesting.
Labour talk about ending the long-term reliance on overseas workers in some parts of the economy by bringing in workforce and training plans for the sectors, including health and social care. Challenge to do, considering, as you mentioned, the NHS is so reliant on workers from other countries and stuff because we just can't retain our own. And then reform the points-based immigration system so it's fair and properly managed with appropriate restrictions on visas by linking immigration and skills policy. I mean, that kind of sounds sensible, but we've also heard similar things from other parties in the past as well. And then Lib Dems talk about exempting NHS care staff from the immigration skills charge, which I think makes it therefore easier for people to come across and support us from an immigration perspective, which actually is, like I said, right now we are in an unusual crisis where we don't have enough people to offer healthcare.
So I think the next section is good, and then we might consider jumping to the reform and green manifestos potentially.
Potentially, I'd like to do the digital one though.
Okay. Yeah. We'll maybe go to digital, then jump to the others. And people are obviously, there's a lot of people watching. Everyone's very, very quiet. So obviously we appreciate the potential, this is potentially controversial, to make comments on these sort of political things. It doesn't normally stop people on our thread from commenting from time to time. But particularly if you've got comments
shout
about
out to EGP regular Miss Melody, very informative as always. Which party is going to be the most likely to stick to their promises? Obviously, we've not talked about that at all, and she loves watching, by the way. So thank you, Miss Melody and stuff. So, prevention inequalities in public health. I mean, this is inextricably linked with health, and as well, in terms of some of the roles we've have and had as well, and policies that absolutely impact healthcare anyway. Tories talk about bringing forward the tobacco and vapes bill. In fact, all three parties talk about vapes in younger people as well, in particular. They talk about major conditions strategy, which meant some of our EGP may remember we covered last year when it came out. So 6 key conditions, and unfortunately I've forgotten them off the top of my head.
It was the main causes of death and illness, wasn't it? So it was things like cardiovascular disease, respiratory illness, mental health, cancer. I think dementia might have been its own section as well. I'm not sure that quite gets us to 6, but it was those sorts of problems, and we thought it was a good document actually. So that's sensible. And of course, there's primary, secondary, and tertiary prevention strategies, that are applicable within that. So, but let's not dwell on that too much. Legislate to restrict the advertising of food products high in fat, salt, and sugar. So that's quite interesting. You hear some Tory figures not in favour of those sorts of things, or particularly historically, accusations of nanny state and so forth. So that's good. Gather new evidence on the impact of ultra-processed foods. So I actually quite like that. That's a concept that I've been learning about on podcasts. The concept of ultra-processed foods and how that's actually quite a useful concept in terms of thinking about how individuals eat and how populations eat. So that's interesting as well. New digital health checks for 2,500 more people every year. So I guess we might get more detail on that in the digital section. And expand HIV opt-out testing in emergency departments in England as part of HIV action plan. So that's interesting. So that's sort of test everyone for HIV unless they opt out when they go through emergency departments. Quite a specific
one of the themes
policy
that does run through in this particular section, all three parties talk about HIV action plans and
is that part of the blood donation? Sorry, the blood products scandal. Is that maybe one of the recommendations?
Very much so.
Apologies,
I think that's what also runs through from every party. They all make reference to that particular action and stuff and things, and they want to implement it. So they obviously see that as a recent development, and obviously one that they're keen to address and stuff as a result of it and things. Labour gets a bit more draconian, I think, in this particular section. So ensure the next generation can never legally buy cigarettes. Ensure all hospitals.
I was going to say, I think that's in the tobaccos and vapes bill, and that was Conservative policy prior to Parliament being dissolved. So I think there's kind of cross-party support for that. But yes, do carry on, Gandhi.
Ensure all hospitals integrate opt-out smoking cessation interventions into routine care. Ban vapes from being branded and advertised to appeal to children. ban the sale of high caffeine drinks under 16s, ban on food junks had for before 9 p.m. Introduce supervised toothbrush scheme. So we talked about this one earlier for 3 to 5 year olds in targets to higher area needs. Halve the gap in life expectancy between richest and poorest regions in England.
Yeah, great.
Yeah, definitely can see that happen and stuff. Hopefully by an improvement in the poor areas rather than a reduction in the richer areas.
Yes, there's a number of ways you could achieve that, of course.
Yeah. And commission a new HIV action plan in England in pursuit of ending HIV case by 2030. I mean, laudable things. I think it's interesting. This section for Labour, very clear, very strong wording compared to some of the earlier ones that we saw in contrast and stuff.
Yeah, there are some concrete things. Those things are either done or they're not done. So you
Yeah.
can very clearly judge success. So nice. Actually, I quite like to see that. You know where you stand. You know what you're voting for with those sorts of pledges. Very, very clear. And of course, a lot of them are not. They don't cost money. This is the interesting thing about many of these things. So there's a bit of money in the implementation, isn't there? But banning junk food advertising on television. I don't know how many under 16s watch TV anymore. But I guess a lot of other people that might buy junk food do. But that doesn't necessarily cost the government money. So, but will impact health, I think. So that's quite interesting to see those sorts of policies. Liberal Democrats, gosh, this is long. I'll take us through this. Introduce regulations to halt the use of vapes by children. Ban single-use vapes. New levy on tobacco company profits to help fund healthcare and smoking cessation services. So, okay, I think that's interesting. Improve access to blood pressure tests in community spaces. So quite specific, but identify and diagnose hypertension, a silent killer. Okay, good. Expand social prescribing and investment in community projects. Protect children from exposure to junk food by restricting outdoor advertising and TV advertising after 9 p.m. It's interesting. I do wonder if there's something to be done about targeted social media advertising, particularly around children, and that might be an area in the future that we're talking about rather than television. Extend the soft drinks levy to include juice-based and milk-based drinks that are high in added sugar. So I think actually this was an exemption in an area that wasn't legislated for in previous legislation around taxation, to cover sort of milk and juice drinks. So that's interesting, and perhaps closing a loophole there. Tackle air pollution and poor air quality in public buildings with the Clean Air Act. So that's about internal air quality. Tooth decay also featuring providing supervised toothbrushing and training for children in nurseries and schools. Okay, scrap VAT on children's toothbrushes and toothpaste. Establish a health creation unit in the Cabinet Office to lead work across government to improve the nation's health and tackle health inequalities. Sounds good. And increase the public grant paid to local authorities to provide preventative services to improve health by 1 billion per year, with a proportion of extra funding set aside for those experiencing the worst health inequalities. So, so actually quite a strong offering from probably Labour and the Liberal Democrats, and a little less measurable from the Conservatives, I guess. But again, there's the lens of achievability as well, that we need to look through too. So interesting. Did you want to skip to digital, Gandhi?
Yeah. So apologies to our viewers. I think we will have to skip because we've spent a little bit more time than we planned. But
giving you a flavour of the document, though.
Definitely.
And the main sort of dividing lines.
And actually, a lot of the stuff that is in the next two sections talking about what was it? Maternity services, women's health, medicines, and cancer, and mental health have partly been covered in some of the earlier stuff as well. So we talked about the 8,500 extra mental health workers by Labour. We talked about some of the other things around extra scanners. So they do repeat themselves a little bit in some of these extra kind of things and stuff. Although the mental health section is quite good to have a look at. I think it's a really interesting one to evaluate and things. But I guess we do talk about health tech. So talking the digital and technology aspects for health would definitely be an important one, I think, for us. Conservatives say they're going to invest 3.4 billion in new technology. We covered that already. What does that actually mean? It'd be an interesting thing. One of the things every single one of the parties aligned to is the concept of using a digital front door. The Tories specifically obviously focus on using the NHS app. Labour talk more about transforming the NHS app and giving it more local-based service use and stuff and things, which is interesting. whereas the Lib Dems don't specifically mention the NHS app itself, but do in the more detailed version. So yeah, it's rather interesting. I think they all talk a little about interoperability, being focused on that, which I think many of us would argue that interoperability is one of the challenges we currently have when it comes to digital access to health and things. But then again, Lib Dems seem to have gone a bit more broader in terms of their policies.
Yeah. So yeah, it's interesting. As always with these the figures, I guess it's the cynic in me. And any of the parties could write the sentence, invest 3.4 billion in new technology. But you just picking that apart, I just think actually the technology might be new, but how much of this is stuff that was already kind of part of the renewal cycle of of IT equipment and things like that. That's I find statements like that a little bit troubling, and I've learned to distrust them over the years.
Yeah.
Because we have our computers, refreshed every few years at the practice, how much of this is existing kind of refreshed really. Because they're talking about replacing outdated computers in the NHS, which is, well, it's absolutely essential, but one might argue that doesn't need to be a manifesto pledge.
No.
It's part of the correct functioning of an organization, really. So, okay. Interesting. Digitize the Red Book for records in children's health. Some might say that's maybe a long time coming. But again, some parents might like having a physical book, that can be carried around and accessed. I suppose many more might prefer an app these days. It's interesting. But what about digital exclusion, and will there be a paper copy available? I don't know. So anything else you wanted to say here? I suppose Liberal Democrats are the only ones talking about virtual wards, or at least in the summary.
Which surprised me. I would have thought the Tories would have gone quite deep into that, considering they brought in virtual wards and stuff and things, but they haven't done. I guess there's also the question of how effective are virtual wards genuinely in overall care as well. So there's growing evidence that shows they can be quite beneficial. Readmission is the part I've not seen a huge amount of information on at this point, but I'd love to be proven wrong on that. So cool. So there are loads of other things that they talk about, other aspects in terms of healthcare pledges in particular. They talk about rollout of particular policies and principles, and all of them mention the infected blood inquiry that we talked about earlier as well, as being a key core commitment and stuff that they want to look at and things. We did say that we cover just a little bit more in depth of the Reform and the Green Party kind of policies and stuff. So shall we go to Reform first?
Yeah, let's do it. What I would say is, for those people who are watching, we know JC's already interacted with us, but maybe just a specific kind of question is, what's your favorite policy so far, or what's missing and what would you like to see? It'll be really interesting to see what people think out there. So
interestingly, on our vote so far, Labour seems to be winning, with others, which unfortunately I could only do 4 options on the vote, being second. So whether that's Reform or Green, I don't quite know and things. But interesting so far.
That's very interesting, isn't it? Maybe it reflects the national polling. So maybe we're changing nobody's mind here, but that's not what we're setting out to do anyway.
Not at all.
So the Reform Party. So there's essentially one page with some pledges around the NHS, and there's some interesting ideas. Really, let's just read through some of them. Really, some of them are really, really interesting. So, critical reforms needed in the first 100 days. So, end doctor nurse shortages. So, all frontline NHS and social care staff to pay 0 basic rate tax for 3 years to help retain existing staff and attract many who have left. End training caps for all UK medical students. So that's allowing places to expand. Write-off student fees pro rata per year over 10 years of NHS service. That would be really, really popular for nurses and medical
doctors.
Staff. So a bit of a kind of cash giveaway to staff, which is interesting. You wonder about affordability, right? But actually no one else is really talking about enhancing pay, within their manifesto, which is effectively what this is doing, albeit via the route of changing this taxation system and writing off student debt. But interesting. What did you think to that, Gandhi?
Yeah, I mean, anybody working in healthcare would probably think that's an awesome thing. I mean, interestingly, so what was it? The basic rate of tax would actually have a huge impact, because there's always this thing that they don't want to benefit, as they call it, the fat cat doctors and stuff versus the other member staff. But actually, that would be a fair and equitable way of doing it, because the majority of healthcare workers who are at the lower paid would benefit the most, and those that are earning more would still end up paying tax on what they earn additional from. Additionally, the student loan aspects would definitely, I think, potentially help retain doctors, because if they leave, then they have to pay back the fees, which would have a huge impact in retaining that. So it's a really interesting policy. It's just a shame it then comes with some of the stuff afterwards.
Well, okay. So next, use independent healthcare capacity. So Labour was saying something very similar about using spare capacity, which is great. So tax relief 20% on all private healthcare insurance. So that's interesting. And I guess what they want is more people having private healthcare insurance and accessing private healthcare to take the pressure off the NHS. And I guess this is similar to VAT, that is not paid on private school fees, for example. So that would be a parallel to it. I think it's it's interesting to see policies like this proposed, and people will talk about them. I'll stick my neck out and say I'm not that the polls are not predicting that reform will form the next government, so it's unlikely to happen. But it's introducing some interesting ideas into the space, which I think are interesting. I don't know if you had any further thoughts on that, Gandhi.
I mean, the question I have is, does this further create then the potential of a two-tier health system? Which is, I think, what many people are concerned about with some of the reform policies and stuff. And I guess, that comes further with the next part, which is thereafter put patients in charge of the new NHS voucher scheme, so then they can basically choose where they go within certain timeframes, which also, again, seem potentially unmanageable unless that includes using the independent sector. Which
I think that's implicit. That's what I understood this to mean. So you could take your if your GP doesn't see you within 3 days, your NHS GP, you could take that parcel of funding and take it somewhere else. So it sounds interesting. I've heard people talk about this in terms of schools, actually, in education policy as well in the past, in terms of enabling more delivery within the private schools sector as well, that you can take your voucher and pay for private school, or you can take it and top it up, or you can go to a state school. The question is, this would require a real reform. Unless this is just additional money, this would require a real reform in the way that primary care is funded, because your GP isn't paid per appointment. They're paid a small sum of money, £180 or whatever, to look after you for the whole year, regardless of how many times you need to see them. And it doesn't easily lend itself to this voucher system, so it might be very difficult to implement. Although I think conceptually it's interesting, and I'm not sure I fully agree with it, but it's interesting. Improve efficiency, cut waste, unnecessary managers. So this is interesting. So operating theatres must be open at weekends. Rotas must be planned further in advance. Okay. Better prices using economy. Nail down. Better prices using economies of scale. Okay, maybe that works for private sector, I guess, and you can reduce costs in public sector within economies of scale, in theory. Review all private finance contracts for significant savings potential. Charge those who fail to attend medical appointments without notice. Abolish NHS Race and Health Observatory. I must admit, I'm not entirely sure what the Race and Health Observatory is. Is that an organisation?
It's a charity organisation, or it's registered as a charity. It was designed to increase the awareness of ethnic minority inequality in roles and that kind of stuff. So very much.
Stick my neck out and say that troubles me. I'll stick my neck out and say
Although in that one paragraph, there's about 6 different policy potentially. So it's really dense in terms of what they're planning to do. Yeah. They talk about then saving A&E, so cutting waiting times, and actually something I think we both agreed was a really good slogan that they came up with.
Yep.
Pharmacy first, GP second, A&E last. I do actually think that's a really good slogan.
Yeah. I think
hats off to them.
They're quite good at sloganeering, actually. Reform, got to give them that. And then excess deaths and vaccines harm public inquiry. So again, it's interesting, isn't it? There's maybe a particular type of person who might be more inclined to vote reform, who would be attracted to that sort of thing. I guess it's no secret. I guess more towards the right wing of social attitudes and the political spectrum. That tends to be where vaccine skepticism also exists. So it's interesting that it's there, and actually we probably shouldn't be surprised that party manifestos contain things that are attractive to people felt likely to vote for that party. I think that's true across all of the manifestos. It's just we see different flavors of it, and that's probably a particular flavor that we see here in the reform.
And I think we definitely see that in the Green Party manifestos as well. So we're just going to have a quick look at those now as Andy switches over. So again, this seemed to be the lighter of the lot from our perspectives, and I mean it comes out to probably about a page of A4. It's by no means, I think, the Greens' strongest area that they look at and stuff in terms of policies. And again, I guess it comes down to how they plan on. Again, I think many of us would probably say they won't form the next government, but they would absolutely have a voice, I think, in it. What did you think, Andy?
Yeah, I mean, there's some ideas that I'm sure many voters would not quarrel with. I do tend to wonder about the cost and how things are implemented, but reduce waiting times, guarantee access to NHS dentistry, guarantee rapid access to GP same day if it's urgent, immediately boost pay for NHS staff, restoration of junior doctors' pay, a lot of what a lot of people would want and ask for. So, that's great. Additional annual expenditure 8 billion for the NHS, rising to 28 billion in total by 2030. Capital spending of at least 20 billion, so probably the heaviest spending pledges in there as well. Increase the amount of money going to primary care, restoring public health budgets to the level they were in 2015-16. So that's interesting, and probably indicates that how much those have fallen in the time. And then nationalists to agree evidence-based approach to reform the UK's counterproductive drug laws. So I guess that's maybe looking at legalization of some drugs potentially. I'm not quite sure. Obviously, there's not much detail there, so that's speculation from me. So make of that what you will yourselves. I think new NHS dentistry contract. Investment in dentistry,
which is what we heard from all the other ones as well.
Reaching 3 billion a year by 2030. I think it really is an important area for voters and for people, for patients coming through. People do talk to us about access to dentistry.
At least half of the out of hours contacts we have in our practice every single day are due to dental issues.
Yeah, absolutely. And then there's a particular section on mental health and neurodiversity included in with their mental health, with increased funding and increased access to, particularly, I guess, to counselling in schools is a priority. But we see a focus on children's mental health in many of the manifestos when you dig a little bit deeper as well. And there's a section on assisted dying as well, which I don't think is covered in other manifestos.
I've not seen it in any of the other policies, no. So they're one of the only ones to me.
Yeah, supporting a change to the law to legalise assisted dying for people suffering from a terminal illness to avoid unnecessary suffering. So that's interesting. And then again, also a pledge on HIV and ending new cases by 2030. Something present across the board. So that is all of the main parties. Thank you for everyone who stayed with us through quite a mammoth
all
section.
140 of you. Yeah,
if you all did. So which is great. So Gandhi, what did you make of that? And I'm going to ask what your favourite policy out of all of them is as well, if you can remember one?
Oh, geez, there were so many, wasn't there? So I think there's a massive diversity. I think if I was summaring this up, I think the Tories have basically gone on the basis that this is what we've done so far, and they put a couple of comments in there. But I must admit, none of their policies kind of jumped out at me and said we're going to make a huge difference in terms of what's going to happen, because I think they're relying on what they've already done, which is not necessarily, some of it's not bad, a lot of it's not great. But I think we're in the situation we're in because of our current government. I think, interestingly, I think many people would have thought that jumping to Labour's policies would automatically be a great winner for healthcare. But I must admit, some of those policies I don't agree with at all, in terms of what they've come up with and stuff and things. And if I'm tending to any, it's probably the Lib Dem when it comes to health, bizarrely. But is that because they've made bold and grander statements, knowing the fact that they probably won't be forming the government, but possibly absolutely involved in the role of it and stuff, and therefore can be a bit broader and louder and stuff and things? And then, like we covered, Reform actually have some rather out there policies which are a little bit more interesting, unfortunately coupled with some really ones I really don't like at all.
They're good bold thinking. Yeah.
Yourself, Andy?
Yeah, so I think my favourite policy is probably not necessarily striking a chord with other people, but Labour had that policy within the workforce recruitment and training section to ensure the publication of regular, independent workforce planning reports across health and social care. And I really like that, because we talk about that quite a lot. So it's a more independent.
Actually, you're right. Every time we've talked about what would we do if we could do anything, that's always one of your go-tos,
independent review of health policy, like we have independent review of budgetary promises in the budget now, and budget policy with the Office of Budget Responsibility and the Office of National Statistics obviously provide independent reports, and to some degree you've got the doctors and dentists pay review body and things like that. So it depends quite how independent they are, but I quite like that policy. So that's the one that I like. There are a few troubling policies in there, I guess. Won't talk too much about Reform, I guess, but kind of the where it says sort of guarantee and legal right to see your GP. I do worry about how about how I've just seen Alexandra's comment come in there. Say, Andy is voting Labour then. I'm not disclosing, how I'm voting. I don't want to influence anybody. I'm keeping my cards very close to my chest. I'm troubled by policies that make sort of guarantees and things. I think it's always very difficult to fully follow through on those. So interesting. If anyone has a favourite policy out there, let us know in the dying seconds of the podcast.
And I guess the question is what we're going to be covering next time. Well, interestingly, the next time we go live will be on election day itself.
So, oh my goodness. That's so exciting.
It is. So you never know. We might be doing a live stream about the election results. I don't know if we want to do that. That's just weird, isn't it?
We could. I mean, a lot of people will be paying a lot of attention probably to the election, but it might be interesting just to give our reactions on election day. There'll have been 2 more weeks of campaigning. People will have cast their vote, I think, and just about you can vote till 10 o'clock.
Majority would have done, yeah. So there'll still be 2 hours to go before we, potentially. So I don't know. What do you think? Do you think we should cover the election on that day, or do you think we should just take a break that day? Because actually, probably most people will be watching the election, won't they? Although the following day, I believe, is the football semi-finals or something like that, so they might be watching that instead.
Yeah.
Either way, as ever, we will still be here to help you understand healthcare and technology and all the other stuff going on in general practice. If you do want to check out other information that we've got, absolutely check out this video right here that's coming up next, which is probably me going live next week talking about how you can use WhatsApp in general practice to help with your patients. That I'm sure some of you want to see. And as always, we'll be here to tech enhance your primary care and learning. We'll catch you in the next episode.